everybody, it's Dr. Sadler here again, and today we're going to discuss delegation. So, what is delegation in nursing? So, delegation is basically assigning ancillary tasks to other staff. And so, what it does, it allows you to be able to use your nurses at a higher level so that they can complete higher level tasks. So, when we're talking about our registered nurses, who can our registered nurses delegate to? Our registered nurses can delegate to other registered nurses, LPNs, licensed practical nurses, or unlicensed assistive personnel. Now, most of the time, your unlicensed assistive personnel will consist of your aides, your STNAs, state tested nursing assistants, certified nursing assistants, home health aides. But it could also include the unit secretary or the housekeeping or whatnot. But most of the time when we talk about unlicensed assistive personnel, that's going to be your aides. Now, LPNs can delegate in some states. So you need to know what your scope of practice is for the state that you're in as to whether or not as an LPN you can delegate. Now here in Ohio, LPNs can delegate. So you just need to know your state Nurse Practice Act, what the Nurse Practice Act says your scope of practice is as an LPN. So which leads me to things we need to know when we're delegating. Our first thing is you need to know what the Nurse Practice Act says or what your state law says is within your scope of practice as to what you can and cannot do. Or what the person that you're delegating to can and cannot do. So as a registered nurse, you need to know what your scope of practice says, but you also need to know what the scope of practice of an LPN is, because you don't want to delegate something that you shouldn't be delegating. Also, you need to know what your facilities policy says. So your facilities policy can make stricter guidelines, but they cannot make looser guidelines. For example, the law says that an aide can take vital signs on a stable patient. However, not all facilities allow their aides to take vital signs. So you need to know what your facilities policies is in addition to what the law says. So like I said, your facility can make stricter guidelines, but they can't make looser guidelines than what the law says. And always remember, you cannot delegate accountability. You are always still held accountable for anything that you might delegate. So that doesn't mean that you have to stand over the person and watch them perform the task, but you have to supervise and make sure that the task is done safely. So maybe you might watch them do the task, or you might check the charting afterwards, or you might check that the patient was safely, if you delegated a Hoyer lift, that they were safely transferred via the Hoyer or whatnot. But you need to be still supervising, because you still are accountable for the task that you delegated. You can't just wash your hands of that task. So what can you delegate? You can delegate uncomplicated, predictable outcomes, stable patients. So your patients have to be stable. If we're talking about delegating to LPNs or unlicensed assistive personnel, they have to be stable, uncomplicated, with predictable outcomes. And so, for example, let's give an example. So, yes, we can delegate feeding to an unlicensed assistive personnel, right? Unlicensed assistive personnel can feed your patients. However, if your patient has dysphagia, that patient is not considered stable because they are at risk for aspiration. So that wouldn't be a stable person. That wouldn't be a person that you're going to delegate to your unlicensed assistive personnel to feed, because they're not stable. Remember, you cannot delegate teaching. So when we talk about teaching, your RN has to do all initial teaching. Now, your LPN can reinforce teaching. So for NCLEX or exam questions that you might have in school, if the question says reinforce teaching, yes, your LPN can reinforce teaching. However, all initial teaching has to be done by the RN, and the LPN can reinforce what the RN has started to teach. You cannot delegate assessments. As far as your LPN can assist with gathering data, but they cannot do assessments. They cannot do initial assessments on patients. So if you have a new admit that's coming in, they're going to obviously need a full initial comprehensive assessment. That has to be done by the RN. Developing the care plan, that has to be done by the RN. Forming a nursing diagnosis, that has to be done by an RN as well. The LPN cannot do planning. All planning has to be done by your RN. And evaluation has to be done by your RN as well. So you cannot delegate those things to your LPN. And we have 5 rights of delegation that we need to consider. The right task. Do the right task, delegate and follow written policy. So remember, I stated earlier that you need to know what your law says, but you need to know what your facility's policy says as well. So, do the right task, delegate it, follow your written policy. What does your policy say that particular individual can or cannot do? The right person. Does the person have the proper qualifications? So you want to make sure you're delegating something that has that is proper, that the person has the proper qualifications to complete. So let's give an example. You may have a registered nurse that's been a nurse for 15 years working in OB. So they're knowledgeable, right? They've been a nurse for 15 years, but they've been working in OB. And then they get floated to ICU. Well, they're very proficient in OB. However, they get floated to ICU. You don't want to give them your critically unstable patients because that's not their forte. And so you want to give them someone that they are going to be more familiar with. Probably a newly licensed nurse, you're not going to give the most critically unstable person. Do they have the credentials? Yes, they do. But as a newly licensed nurse, do you think they're prepared and able to provide care for a critically unstable patient? So you got to think about those things, right? And then we're going to talk about some things your LPN cannot do as well, that we're not going to delegate certain things to our LPN as well. The other thing I want to say is, if you are the RN delegating and you have, say you have LPNs and unlicensed assistive personnel to delegate to, you want to use your LPN where you can best use your LPN. So yes, my LPN can actually do everything my unlicensed assistive personnel can do. But if I have a med pass that consists of all oral meds, and then I have a stable patient that's had surgery 5 days ago and needs to ambulate, I could delegate that ambulation to the unlicensed assistive personnel, and then delegate my med pass to my LPN. Yes, my LPN could ambulate that person. However, I want to use my LPN where I can best use my LPN, and that's passing the oral medications. The right direction or communication are instructions and outcomes communicated. You should not leave, you want to be very clear in your delegation. That means state the time you need it done, how you need it done, how you want the results reported back. So if we delegate, if we have an unlicensed assistant personnel and you delegate doing a blood sugar to that unlicensed assistant personnel, you need to be very clear in your communication. If that blood sugar is less than 70, report that to me immediately. If the blood sugar falls between 70 and 100, document it, and then I'll check it, by 10 a.m. or, when I get a moment or whatnot. Never leave it up to your unlicensed assistant personnel to make a judgment call. It is not for your unlicensed assistant personnel to know that if it's under 70, action needs to be taken. You need to be clear in your communication and saying what you want them to do if the results are this or if the results are that. Be clear in your communication of the time that you need it done. Don't just say do AM care for rooms 1 through 5. Be specific. What do you want done? Who do you want done first? And then, who's next? And, be specific in your communication. You want clear, unambiguous communication when you're delegating. And the other thing is, you don't have to be mean and nasty when you're delegating. It's okay to say please and thank you when you're delegating. Okay, the right supervision or feedback. So as I said before, you cannot delegate accountability. You still need to supervise, and then you need to provide some feedback after the fact. So if there was something that they could have done a little bit better, then share that with them. If they did a great job, share that with them. So provide feedback after the person has completed the task. And like I said, it's your responsibility to ensure that the task is completed safely. That does not mean you have to stand over the person and watch the person the entire time, but you do need to ensure that the task is completed and completed safely. And in the right circumstances, are the tasks being delegated possible without independent nursing judgment? As I stated before, it is not up to the aide to make judgment calls or to know that action needs to be taken. So we're not delegating things that require a judgment call be made. We're not delegating things that need to be evaluated or assessed. And our aides are not doing any teaching or any assessments or any evaluation. So you're never going to delegate those things to your unlicensed assistant personnel. So when we look at our unlicensed assistant personnel, certified nursing assistants, or our aides, like I said, they can perform basic care on stable patients, stable, uncomplicated patients with chronic illnesses. So that can include feeding, assisting with ADLs, ambulating, things like that. You want low-level skills. Like I said, they can do feeding, but remember, if that person has dysphagia, then that is not a stable person because they are at risk for aspiration. LPNs. Now, your LPNs can do most tasks, but there are certain things that they cannot do. Like I said, they cannot do initial assessments. So they cannot do admission assessments. They cannot do IV push meds. They cannot write nursing diagnoses. They cannot do initial teaching. So they can do most of the teaching is done by the RN. So that initial teaching, so you have a new diabetic. Initial teaching has to be done by the RN. However, remember I said your LPN can reinforce teaching. So when you're looking at your questions, your exam questions or your NCLEX questions, if it says reinforced teaching, then yes, your LPN can do that. Otherwise, no. Complex skills, you're not going to delegate to your LPN. They cannot take care of clients with acute conditions because they are considered unstable, unpredictable. You don't want to delegate those type of clients. And then they cannot take care of unstable patients. So let's look at a couple of questions here and see how you would address these. You have Mrs. Smith is a 70-year-old female who has recently been transferred to your unit with a diagnosis of congestive heart failure. Medications include diuretic, digoxin, and an ACE inhibitor. She has begun to display decreased levels of consciousness at times. She is on 2 liters of oxygen via nasal cannula with a pulse ox of 90%. Her temperature is 38.2 degrees Celsius. She is on strict I&Os and has an indwelling catheter. Would you delegate any task for Mrs. Smith to an unlicensed assistive personnel? And if you would, which task would you delegate? So let's look at this. Let's break this question down. What's going on with this patient? Well, they were just transferred to the unit. So they're new to your unit. They're on a diuretic, digoxin, and ACE inhibitors. This person has decreased levels of consciousness. Remember, your level of consciousness is one of your first indicators of brain function. And this patient's level of consciousness is decreasing at times. So that's indication of something's going on. Something's not right there. And her pulse ox is 90%, which is on the lower side. So something's going on with this patient. They're not really stable at this time. So no, we're not going to delegate any portion of this patient's care to an unlicensed assistive personnel at this time because the person is unstable. Okay, let's look at the next one. Mrs. Jones is a 55-year-old female on your unit following a hysterectomy 2 days ago. Her post-op course has been uncomplicated. The surgeon has ordered for the client to ambulate 3 times a day and check vital signs each shift. Her vital signs are stable and she is alert, oriented, and cooperative. Would you delegate any task for this client to your unlicensed assistive personnel? And if so, which task would you delegate? So let's break this question down. So she had a hysterectomy. The hysterectomy was 2 days ago. So since then, she's been uncomplicated care. Her care has been uncomplicated, and the hysterectomy was 2 days ago. So she's pretty stable right now. So we could delegate some of her care, some of the things that need to be done to the unlicensed assistive personnel. The unlicensed assistive personnel can ambulate the patient 3 times a day as needed. And the unlicensed assistive personnel can also check her vital signs each shift. Her vital signs are stable, she's alert and oriented, everything is uncomplicated. Yes, you can delegate those things to the unlicensed assistive personnel. Now, always remember your 5 rights. And so, remember we said when we're delegating, we want clear communication. So don't just say delegate or ambulate the patient 3 times a day. Be specific. What times of the day do you want that patient to be ambulated? How far do you want that patient to ambulate? Do you want her to use the walker? Do you want her to use a gait belt? Be specific in your communication. And then how do you want the aide to report back to you after they've completed that task? So be clear in your communication. And again, remember I said you don't have to be mean or nasty about it. It's okay to say please and thank you when you're delegating tasks to other individuals. All right, so that wraps up our video on how to delegate. So if you like this video and you'd like to see others like it, then please consider subscribing to my YouTube channel, Creating Future Nurses. Thank you for watching and have a great day.